Okay, we're gonna get started here, and I'll call the meeting to order now. This is the appointed hour for the weekly finance committee meeting of the commissioners. So we do have minutes in hand. I'll entertain a motion in regards to those.
I'm going to move to approve the minutes of October 28th and November 4th.
Second.
Moved and seconded. All in favor, indicate by saying aye.
Aye.
Motion carries. Okay, that brings us to the main topic of today, which is, of course, the human services budget. And I guess, Annie, are you presiding, or is Annie Straight in the Human Services Department? Who wants to take charge? Annie, you're a take charge person.
Sure, I'm willing to start off the conversation, and really, at first I just want to say thank you. We had requested this meeting predominantly out of a lot of concern, because we were part of the 5-month approved budget by the governor's office, and last Friday, the governor's office, legislature approved the budget, and I believe the governor then signed it. But we still do not know specifically how that will play out for all of our human services departments. So we're waiting for clarification. We do know that there are parts of the budget where we'll see likely small increases, and other parts of the budget where we're likely to see small decreases. Thankfully, we believe we'll be okay. But we did want to at least follow up with the meeting with you folks and more specifically talk about some of our concerns with the flat funding, at least specifically around the mental health budget. You would likely have heard me talking recently about concerns in crisis intervention and some of the significant increases we're seeing in crisis intervention. And of course, under the state mandate, what we should be working with is individuals with serious mental illnesses. And so that is predominantly where most of our fiscal resources are expended. Given the pandemic, we're seeing parts of our service delivery system that aren't able to be used as highly as what they typically would be because of the pandemic and because the providers aren't able to see people face to face. The other side of that is we have crisis intervention who we are seeing significant increases in, and we're basically wanting to make sure that the commissioner's office has, I'm going to say, a solid understanding of what's happening in the community, so that way then, should we need to make strategy changes, and I've worked county for almost 20 years, we've always paid for services like social rehabilitation for individuals with serious mental illness. But yet those services specifically aren't really able to meet like they typically would. We're actually having conversations about, does it make sense to redirect some of those resources perhaps to crisis intervention to strengthen their ability to serve the community better because of the COVID outbreak and because of some of the increases in crisis that we're seeing. So I didn't know if you wanted to, I don't know if any of the other department heads would like to kind of weigh in as well, specifically around their aspects of the budget, just to round out the mental health piece.
So I can speak to the IDB side and the EI side a little bit. As of right now, with the positive percentage rates up in the substantial community spread area, our day programs are basically all closed now. So we do not have those folks going to day program, and they will not reopen until with folks around employment, and they were not able to stay open anymore. So a lot of our day programs are associated with our larger providers, like the Cumberland Arc and the United Cerebral Palsy. So I think that those being larger organizations, what happened in the beginning of COVID was when they closed the day programs in March, they moved the staff from the day programs into the residential programs, which helped to staff those programs better since all the care was going to be given at home now. So I think that they are moving the staff. They actually haven't come out and told us that they are doing that again, but I would imagine that as the residential programs also tighten up and aren't allowing as many visitors from even families, they probably are taking some of the day program staff and having them help out in the residential programs again. So, and as for early intervention, I can tell you that they were doing more face-to-face because that is what the families wanted, to help with the therapies with the smaller children. But when we hit the substantial community spread numbers, they had to go back to all remote. So just this last week, I think Cumberland was at 11% and Perry was at 12%. And I don't, those numbers come out on Friday, so we're going to see the numbers go up a little bit more this week, I would imagine. But so that's the state for ID and beyond right now as far as what's happening in the community and what's happening with providers.
So let me just then also weigh in and say that there's fiscal implication with this as well. So last year, on the mental health side, we actually requested a special waiver from the state in order to continue to pay our social rehab providers during the pandemic, even though they weren't able to see people face to face. They were still doing some outreach, they were still making phone contact, but we basically met their needs. And similarly, for Sue's program, I believe the same thing occurs. A lot of her services are paid for under state waiver, but that basically meant that Sue had leftover money at the end of the year as well. And that's the piece that we are equally as concerned about, because with the flat funding piece, we want to, as much as possible, be able to reallocate resources, where it makes sense in both of our programs.
Yes, because when we do not have the day programs open, we are not spending that money out of our base. And so we are having funds left over. Now, we were able to do a, what do you call that plan, Linda? Sorry.
Reinvestment.
It's the retainage, it's the retainage plan.
It's a retainage plan. I kept wanting to say reinvestment, but it's a retainage plan. And so what we did with the money that we had left over last year was to offer it out to providers, residential providers, for help with projects that they needed done in their homes, such as roofs, windows, painting, floors, whatever, handicapped accessible bathrooms, and also vehicles, because some of the programs that needed to replace some vehicles. We were able to expend that money this year to help our providers. So I think it was in the area of $350 plus $1,000 that we were able to give to providers this year.
So do we anticipate, even with our retainage plan, that if there's anything left over at the end of the fiscal year, that the state will want it back? Okay.
That's a concern. I think
Yeah, that's a
really
huge concern.
Mm-hmm.
I can speak under the retainage plan, we're allowed to keep 5% of the state funds from year to year. And that comes out to, for Cumberland, I think it's probably around $600,000 that we can keep. That, because of how the Human Services Block Grant is written, I don't believe they'll be able to take that funding for us
our social rehab programs. Unfortunately, many of those folks aren't able to participate right now anyway. So, you know, then I don't wanna do things that would potentially hurt them, and then I also am concerned that we're paying for a service that, or potentially paying for a service that isn't being utilized.
Yeah. Are there any new services on the horizon as companies are adapting to the pandemic? Is there anything innovative out there that's dealing with, you know, NHIDD issues in a different way?
We would love to be able to see things change and grow, and actually, in some ways, I wonder if this may not be an opportune time to sort of nudge things in a different way. So, for example, if we do strategically decide to start to cut some of the social rehab services, it encourages people who are able to, let's say, find employment, to be working on things like finding employment. Social rehab by mission is supposed to work with individuals with serious mental illness in order to help them with socialization skills. But what we find is that some people value that service and therefore don't have the same level of motivation to get employment that others do.
Okay.
On the IT side, we're looking to use more assistive technology. We've been exploring, using that to, help families that don't want a lot of staff in their homes. We, have a new provider, Safe at Home, who has a way of having a manned, support system. So they install an iPad with the consumer, and then they are connected to a support staff whenever they need to talk or whenever they need help with something. Now, this doesn't work for everybody, but it does work for folks who are more independent. And so we are really exploring, using that more. And, so, yeah, assistive technology. And just to let you know that our folks who are employed, who up 1% in our employment rates. So our folks who were employed at like Walmart, Giant, and those kind of stores, they continue to work.
Mm-hmm.
They did not folks off either, and our folks continue to work. So we are very happy about that.
You know, I have a friend in Cumberland County who has some intellectual disabilities, some developmental disabilities, and he's just very lonely. You know, all of those things drop by the wayside. And he, you know, I talk with him on the phone, and he'll say, "Jean Fashi, you know, when can we go to lunch?" Or, you know, "When can we do this?" And I said, "I'm really sorry, we have to get through COVID." He is terribly lonely, and so I think that's really an interesting way to work with things with iPads and technology. That's a good thing.
Yeah, so we're really looking to
Is there, and I mean, I have to wonder, is there anything that we could create? Like, I don't know that if we, you know, if that's something that we're in the business to do, or if we're at the mercy of all of these programs, but I do wonder if there's something we could create with this reallocation.
I think that's something that we should discuss and see what makes sense. Yeah, I mean, I think to efficiently serve public, if we were able to do that, that would be great.
Yeah, I'm just an idea person though, Annie. Like, I have ideas and I throw them out and then I never know what to do with them. I'm very helpful like that, so.
I appreciate that. I'm an idea person
passed the budget, and pleasantly surprised, because we were really bracing for the potential for a cut in our state funding. And I think that was the original purpose of requesting this meeting, was so that we could do some problem solving and some planning around how are we going to manage those cuts, what care do we need to take to make sure that we don't lose providers. And so I think that a lot of those concerns have been assuaged. I do have to tell you, though, that while the news is great, and my anxiety is somewhat allayed, I'm not gonna be totally assuaged until I see the details, because we've yet to receive any detailed information from our state agency. The most information that I've received is the email that Stacy was able to share yesterday with us from CCAN. And that had some details in there, but it's still quite general. And there was nothing in there about the drug and alcohol funding. So we're still a little bit nervous, feeling much better than we were a week ago and over the last few months. The other part, though, is that we are still waiting. I think everybody knows that our funding, like most human services, is a mix of state and federal funding. We have known for some time now that our federal block grant funding is flat funding, and it is the same for the full fiscal year. But we have not heard yet what our allocation is for the remainder of this fiscal year for our opioid response fund. And we have enjoyed an influx of additional funding to address the opioid health crisis for a couple of years now. And fully anticipate that that's continuing with this year, but we just haven't heard the specifics from our state agency. So that's the other thing that keeps me on pins and needles a bit. Our service system, I think, is a bit different than IDD and MH. We don't have social rehab programs. We don't have drop-in centers. Most of our services are on a fee-for-service basis. They have had to adapt to the pandemic mitigation guidelines, and there's a lot of scrambling that happened back in winter and spring. The folks have made that transition, and so now services are currently being operated on what folks are referring to as a hybrid fashion. There are in-person services available for outpatient, intensive outpatient, partial hospitalization, and that means that those who are able to attend in person can do so, but they also have the option of participating by phone or by video conference. And so you have some group counseling that's occurring with 2 or 3 people on site in person, and another 2 or 3 tuning in via Zoom. And so that's a good. I'm not quite sure what this uptick in cases and hospitalizations and deaths is going to do. I suspect that it's going to lead everybody to being more careful. Fewer individuals may be comfortable attending counseling in person, and may opt for telehealth. And some of our providers may pull back a bit as well. And so we'll have to see. But fortunately, if there is a greater shutdown of in-person services, we're much better prepared now than we were back in March, April, May. And so I think we can accommodate that. And yet I am concerned because I think the point has been made that social isolation and addiction don't mix well. When somebody's in active addiction or in early stage recovery, social isolation is the last thing we need. they really need to have access to counseling services and support groups. And so I am somewhat concerned about that. Now, while we are still waiting to hear what the specifics of our state funding is for the rest of this fiscal year and what the rest of our federal opioid funding will be, we did just last week get some good news that there was an opportunity to request some additional money for drug and alcohol partnerships with law enforcement. And so we did see that as a chance to expand the warm handoff efforts of JFT that they've been doing with the hospital emergency departments to offer some follow-up to our police departments for individuals that they've encountered through their use of naloxone. And so we just got that news. It'll allow us to add another contract with JFT so they can expand their certified recovery specialist staff to do some follow-up with folks with substance use disorders at the police department. And so that's good news. And in response to Commissioner Fossey's question about are we able to do anything new? The other thing that we're trying to do new in anticipation that there might be, if there is a shutdown of support groups, in-person support groups, because of this uptick in COVID cases, that will put more people at risk. I'd like to see an even wider distribution of Narcan and naloxone in our community. And the state is clearly willing to do that. They have expanded the definition of first responder to include recovery specialists, all of our treatment providers, and any family and friends. And so I've been in touch with Dwayne Nieves, who is our central coordinating entity for the distribution of the free naloxone through the PCCD fund. And Dwayne had expressed a concern earlier, and that is, well, it's great if they're going to expand the definition, but it's not so helpful if they don't expand my allocation of naloxone. And so I'm waiting to hear back from Dwayne with the confirmation that the allotment or allocation of naloxone supplies for Cumberland and Perry counties have been expanded. And if so, then we'll be able to distribute naloxone through other means. We won't have to rely so much on our first responders and our police departments. Let me shut up a bit and see if there's any questions.
Gene was just going to suggest that.
I can read body language even with face masks on.
Jack, I'm really pleased with that expanded program with JFT, and I know it's just a 10-month program, but I think it really is the beginning of something truly fantastic that I hope will be sustainable.
I hope so too. It is funded entirely with the temporary federal opioid money.
Mm-hmm.
And although technically, this money is it's called state opioid response money.
Yes.
And it's been expanded in year 3, so that it can also be used with folks with stimulant use disorders.
Good.
So that's been expanded a little bit, and we've been told that if we're able to show some good deliverables, there's at least a chance that it could be extended for an additional 12 months.
Good.
Beyond that, I do not know that.
Well, I think that's great. Are we spending any time worrying about 2022's budget?
Well, believe it or not, yes.
Yeah, that's the one that's making me crazy.
Yeah, and that's why I think, it's super important that we're having these conversations now, so that we can be decisive as the year rolls on. The other thing
plan for any more than 5%, right? So if we don't
That's all
spend
we're
it,
permitted.
you what?
That's all we're permitted. If it's more than that, then I think it's fair game for the state. to do
Yeah.
that.
Yeah. It's too bad, because,
Just to let you know, they did increase that. It used to only be 3%.
okay.
And the state increased it to 5%, I believe, a year or two ago.
All right. Well, I appreciate your update. And I am glad that there's a budget that was passed.
I'd say that we're, I think, and Jean, you know this, we've been meeting with police officers and, you know, basically trying to do a better job supporting them in the work that they do. And, you know, just like Jack was sharing with the expanded definition for Narcan use, I think that's an excellent tool as well. Because of the meetings with the police just last week, we were able to provide some suicide prevention training with law enforcement. That's something we've never done before. And so I was particularly excited about that. They were willing to take time and receive that training.
Good.
There are a couple other thoughts that I think might be noteworthy. And they're, the first one is good news, and that is I did notice in the information we have in the state budget that one of the areas of funding that was increased was for medical assistance. That's relevant because a lot of medical assistance is for behavioral health. And while we have been worried for months now about the state budget, we've known for months that the current rates for our regional behavioral health choices program have been are quite favorable. And so we're in very good financial shape there. That's significant because there's a lot of county residents who get their mental health and the drug and alcohol treatment services and case management services paid for through health choices. So that's a piece of good news. The other item that is a little bit up in the air is the current challenge at the Supreme Court level to the Affordability Care Act. Just as a quick reminder, the Affordability Care Act includes Medicaid expansion. And if it is overturned, then Pennsylvania would lose its opt-in to MA expansion as well. And that would mean a lot of people who are currently having their drug and alcohol treatment services paid for with by health choices would now end up having to come back to the county and ask us to pay for their treatment with our cap. We are not an entitlement like medical assistance. So that's something to keep an eye on. I know that there were some preliminary arguments heard on that already, and I think they anticipate a decision sometime in January on whether or not the Supreme Court will even hear that challenge.
That's a big one.
Yeah, that has implications. There's always alligators in the water.
That there are.
That's why I don't like to go to Florida.
Okay, anyone else?
No, I don't think so. I think we wanted to just make sure that you folks felt like you received an update, especially since the budget was passed.
Yeah, that was good. Yeah, very timely, definitely. Okay. All right, well, thanks for the input. I'm sure we're gonna continue to be monitoring it pretty closely, and we'll be looking for all the updates that come along. So we'll close that out as the topic of discussion today, and move to item 4, which is other business. Do you have anything additional?
Well, I have one thing that, if possible, you know, I talked to Stacy about the possibility of meeting with the commissioners later on about our assisted outpatient treatment opt-out, which is something we did last year as well. Under Mental Health Procedures Act, there is part of the act where we can maintain, for individuals who struggle with compliance with treatment, there's a part of the act where a person can maintain a civil outpatient commitment. So it's an involuntary commitment to outpatient treatment services that we monitor annually. And about 2 years ago, the state approved this assisted outpatient treatment law, and there is an option to opt out of it. And so far, all of the counties in the Commonwealth have opted out of this, in part because we all firmly believe there will be additional costs associated with it, as well as the fact that there are parts of the law that honestly, philosophically, we have concerns about. For example, one is that you could court order a person to receive peer specialist services. So you could court order somebody to have a person in their life who is supposed to be supporting them in learning about their personal recovery. Anyway, every year we have the responsibility of talking about this and making sure that our commissioners are aware of our desire to opt out of this. And there's a form that I'm supposed to specifically complete. And then I have to, make the state aware of whom I discussed this with. Last year, we discussed it with the commissioners and you all were in favor of our continuing to opt out. We have a procedure in place here in our office where we do have some individuals, a few, who are on outpatient commitments, and these are monitored every month. So our case management staff reach out to provider staff and make sure that these people are receiving the treatment that they need to receive to be well. And that's why we believe that it's probably appropriate that we continue to opt out of this.
Okay.
So Annie, we have that scheduled for a meeting, December 9th. You wanted to go in depth with your rationale. Do you want to keep that meeting?
If we don't need the meeting, then absolutely I'd be fine canceling
Yeah, and I will not be in town on December 9th, so.
it. So maybe this was opportune then.
Okay, yeah. So we could, because when Annie and I spoke about it, she thought it might take longer than the time that we typically have available at a workshop. Because I think our first thought was, we'll have it on the December 10th workshop for discussion, and the December 14th BOC meeting. And Annie wanted to be able to give you enough time to really digest what she was saying. So if you don't think that another finance meeting is necessary, if the commissioners don't feel that that's necessary, we can certainly circulate the paperwork that you have in advance of the workshop.
That's fine.
Mhm.
Let's do it that way.
Yeah,
Okay.
Makes sense.
That's
All right.
the work session.
Yeah, thanks for using the extra minutes wisely, Annie.
All right, great, thank you.
Thank you. Okay, once again, other business, anything additional? I'm not hearing anything, so we'll open the floor for any public comment. Anyone on board?
So you, asked to unmute. And then it may just take a second. And if you're like me, you'll hit it one more time. So.
Everybody's like you, Stacy.
I know. But I do. It doesn't help, but it makes me feel better.
If she's unmuted.
Okay, there we go.
Joe Bitzer.
Ms. Bitzer, now's the opportunity for public comment. I'd ask you for the record to identify your municipality, and then the floor is yours.
I live in Oak Island Township. I do not have any public comments. I was just tuning in to learn. That's all.
Okay, very good.
Thank you.
Thank you for your attendance today. Okay, we have no other public comment then, I assume?
No.
Okay, if that's the case, I'll entertain a motion for adjournment.
Move to adjourn.
We are adjourned. Thank you all.
Folks, highly